Welcome, everybody, this afternoon. My name is Nancy Allen. I am a nurse. I work at the ICAHN office in Illinois, and we're going to talk today about, is your survey return where you want it? We've heard from a few people, and it's just, if you search out this topic anywhere, you find a lot of people, on there saying, how can I get my survey return rate up? So I wish I had a magic bullet to give you or a magic strategy, and I don't. But what we will do today is talk about some combined strategies and talk about some objectives we want to accomplish today and see where we can get. And then I hope that we can have some pretty good interactive discussion at the end of what some folks have done, because we've got some people that have had really pretty good success with getting their results in, and that's what we want to talk to them about. So let's kick this off. So our objectives for today, we hope to cover is establishing benchmarks for your departments or your service lines, discuss how your return rates impact your results, identify opportunities for process and performance improvement, and discuss improvement strategies. And as I said, hopefully have some pretty good discussion at the end to talk about what our peers are doing, because there's nothing better than those stories from the field of what everyone else is doing and getting their return rates up. So as we kick this off today, I found this to be a very interesting statistic, and I know we're always a little behind with CMS, but on average, there are 7,700 patient-completed HCAHP surveys done daily. It's a lot of surveys. The March 2021 HCAHPS fact sheet update stated that 4,517 hospitals reported their HCAHPS scores, and according to 2.8 million surveys that were completed in October of 2020 is how they come up with the average of 7,700, which is a lot of surveys considering the fact that the official implementation was in October of 2006. And although it seems like we've been doing this forever, it was just March 2008 when we got those first official results that we saw from HCAHPS. So we talk HCAHPS all the time, and why are they important? And we especially, we think of it in our small hospitals, our critical access hospitals especially, that aren't mandated yet to do it. And we hear about our value-based purchasing, based on our HCAHPS scores. But we also know that we really do want to know what our patients are thinking. And before HCAHPS, there were numerous providers that collected data on patient satisfaction, but there wasn't a national standard for collecting or openly sharing the patient's opinion of their care. And the HCAHPS scores, as we know, is very scripted, and it's the same. Scores have provided a means for a meaningful comparison between hospitals. So how do the HCAHPS scores benefit our patients? And I think a little bit of this, you may be saying, no, wait a minute, this was on survey return rate. Why are we going here? But I think it's just important for us to review that the HCAHPS surveys offer our patients the opportunity to provide input on the care they've experienced during an inpatient stay, from the bedside to discharge. It covers the full range of the experience we're talking about. And these insights can really help us as hospital leaders better understand our patient needs and address areas for improvement. And we've seen that over these years since 2008. And as these survey results are publicly available on Care Compare, our patients are using these scores to make decisions about where they go for their health care. And so it's very critical to all of us. First, from that compassionate side that we've always had, but also from a good business and financial side to make sure our scores are where we want them to be, so that patients have trust and they choose our services. So how do the HCAHPS scores help the various types of healthcare teams improve their delivery? It's a good source of obtaining feedback directly from our patients on their experiences with many aspects of the care delivery from the questions we know. The HCAHPS provides the hospital teams with valuable insights. Your team can use the data to determine where environmental and care gaps exist, and develop targeted improvement efforts. It takes away some of that guessing. If you really look and you're seeing trends in your data, it's an area to focus on. HCAHP surveys have become a core patient experience measurement for hospitals throughout the nation. And it's crucial to understand your hospital's reporting requirements and how HCAHP's results are publicly reported, and who the reputable and experienced vendors are when implementing your HCAHP surveys. And as we're talking today, as survey solutions. So one of the things, so as I said, so what does the return rate mean in all of this? I feel like this little guy, when I was back in my role as a chief nursing officer, and I would get him, it's like, okay, where do I go from here? So one of the things that we know is that the volume of surveys is often very difficult for small hospitals to get to make sure that we are making good decisions based on our census. So it's really important for us to have a good response rate. And my overarching question is, because I know for me, I had to go back and look at this, is what was my HCAHPS response rate? How many surveys were sent? How many did I get back? I needed to know that. And when I first began to look at this and look hard at it, why I was seeing some of these trends, it was like, what is my numerator and denominator? So it was very important, and it is for all of us to go back and look to see how many of our patients were surveyed and how many surveys were returned. This was a statistic that I found in QI Institute, that for each 1 percentage point increase in a hospital's HCAHPS response rate, it's expected to result in a 0.5 percentage point increase in the mean top box score. So we really see why it's important for us to get as many surveys back as we can. And it's just overall important that we get those surveys back so that we have a true picture of our population's response to those questions. So I wasn't sure, I figured most of you knew this, but I went through our process because I wanted to just review it quickly with everybody and go through it step by step. So how do we get our numbers? Where does the numbers come from, and how do we get the data? So you have worked with Holly and have your data submissions that come through. So you submit your data post-discharge to Survey Solutions. And that data has to be submitted to us. CMS dictates this within the time frame of 48 hours to 42 days post-discharge of the patients. Then we receive the data and it has to be checked. It has to be checked for completeness, make sure there aren't gaps, that there aren't things that the codes are in, that everything is complete. Best case scenario, everything is complete, and those surveys are sent weekly to the patients from Survey Solutions. And then because we have that 42-day window, if time allows, if there's no response in 21 days after the first survey is sent, and we haven't hit the 42 days, then another survey is sent. So people can get 2 surveys. So that is the steps with which we go through on our side to get those surveys out. So that's on our side. So let's look at some strategies, as we talked about earlier on in the objectives. Let's look at some strategies to improve our return rate and see what are some things that we could possibly do. So timing matters. As all the experts say, speed up things. Patients receiving surveys sooner after discharge are more likely to respond and give you higher scores. So if you're sending your discharge list to us daily, that's great. If possible, weekly at the latest, but get that data to us as soon as possible so that that process can begin. We can look at that data and get those surveys sent. And as we talked about, sample size matters. The larger the sample, the more reliable the information, and the greater the power for analyzing results for improvement. It's best to survey all eligible discharge in small and medium-sized hospitals. And I have a feeling that's probably what most of you are already doing for your HCAHPS is all of your inpatients. And remember, this is only for your inpatients that you're surveying 100%. So those are the two more process-oriented things we can do. Get those surveys out as soon as possible, get those discharges to us, and sample everyone we can. But the area that we can have the greatest impact when we're in the hospitals is telling our patients that their opinion matters. And we really need to go out of our way to convey to the patients that your hospital is actively interested in receiving their input on the stay and the quality of care. You know, patients should feel invited and empowered to share their opinions and perspectives throughout their stay. It's important that they know that those are kept confidential. In a lot of our small communities, people think, oh my gosh, you know, I don't want to hurt anybody's feelings. I don't want them to see, you know, what I've marked. Or you may be shaking your head with me saying that, saying, not with us, you know, people really do let us know. And that's good. But we really want to invite them and empower them to let us know their opinions. Share with them improvements that you've made based on patient and family feedback. You know, if you've made some real improvements, you've changed the main entrance to your hospital, you've changed the hours that dinner is served, you know, things like that. Let them know some of those things that survey results has helped make an improvement in your facility. But the biggest thing I want to go over in a lot of different ways here is to inform the patients that they may receive a survey after discharge and that we're eager to hear about their experience. So often, you know, when I ask people, have you talked to your patients about the survey, you know, that they'll get a survey and how important it is for you to get that survey back so you can use their feedback to improve the care. I hear a lot of comments, and often those comments will be, oh, we can't do that. CMS says we can't do that. So we're going to talk a little bit about what we can and what we shouldn't say to our patients. But at every juncture that we have the opportunity to let our patients know that they'll receive a survey from us, I feel that's very important so that they feel, as we said, empowered and invited to fill out that survey and get their input back to us. So part of the communicating with our patients about HCAHPS that we see is that, you know, it is very acceptable to let them know that they'll be receiving a survey, as we said, after discharge, and let them know that that survey is going to ask them about their stay. Encourage them to complete it and return it. Talk about the things I just did about improvements that are made, changes that are made as a result of the survey information we receive, and just let them know how important that is and thank them. You know, we always, when we think of the tools that we use that we've talked about in other webinars, you know, and AIDIT is so important to all of us, and we need to thank them for their stay. We also just want to thank them for basically filling out a survey. So what's unacceptable is really prompting them with verbiage or with how we want them to answer the question. So we can't ask them, you know, it's unacceptable for us to ask them any HCAHPS, the direct questions, or HCAHPS-like questions, you know, of the patients prior to the admission of the survey after discharge. And that language is coming straight from CMS. So when you think about that and you think about how the verbiage is on the survey, you just don't want to ask them those direct questions. But we all know there are a lot of other questions we can ask them and share with them about filling out the survey. We don't want to attempt to influence or encourage our patients to answer those questions in any particular way, because that's just unacceptable. And that is where a lot of the the comments from CMS comes in about using terms like always and things like that, in our survey to them, although that's what we want them to fill out, we are not to encourage them in any particular way by using those terms directly with them. We have a lot of opportunities to talk to our patients about the survey they'll be receiving. And it's not, one of the comments we hear, sometimes from staff is, I have too much to do already to worry about reminding people to take a survey or telling them they're going to get a survey. Do you realize all the care I'm delivering? And I'm very well aware of that, especially with all the past couple years we've gone through. And a lot of you are working with less staff than you had. So think of ways to incorporate it in work practices that you're already participating in. And some of those strategies involve leadership rounding. As you do leadership rounding at your facility, this is your golden opportunity to address areas that you see that are coming in with lower scores on your surveys, albeit your patient experience surveys, your HCAP surveys, whichever questions, script yourself around before that leadership rounding on what you're seeing on the unit. And look at, just as important as looking at the issues that you're seeing there and the trends where look at your volume of surveys that are coming back in. And if you're really seeing that ebb and flow, it's a time to really emphasize, as always should be, but really emphasize the importance of returning those surveys to you timely. That they'll be getting them when they go home and how important it is for us. And I know I sound like a broken record with that, but that's basically what we need to do. It's like at every juncture in the road that we can remind them how important that survey is. That's what we need to do. And leadership rounding really provides a good opportunity for that. Posters. I know a lot of you have received posters from Jake, and you have those posters. If you don't and you want those, please request posters from us. We can get those to you, and I'll be happy to follow up. I should have included those in my slides, what the posters look like, but I'd be happy to send anybody a screenshot of those. But put those posters up around your hospital so that your patients and their visitors, their family sees that, reminds them how important and the value add of them returning their survey. And staff engagement. Share with your staff why it's so important for us to get those surveys back. This is a good opportunity. Often, patients put some really good comments on there that we can share back with our staff. And more often than not, that is what we get. And we also, we want to know, and our staff wants to know, the processes we can change and what our patients expect of us. And this is a good opportunity. But if your staff that are not seeing the results of your HCAP scores, if they're not understanding why this is so important to us, it's a little hard for them to become engaged in really advocating for their patients to fill out those surveys when they get them. So communication examples that supply, I know I gave that comply, I gave you a few before, but as really looking at this to give some examples, for staff, I know often, both leadership and staff, we're looking for things, give me some questions I can ask, give me a script I can, of what I can ask so that I don't cross the line. And here's some very simplistic, and you can develop your own, but some examples of what complies. And it's directly from the CMS literature that, just let them know we're looking for ways to improve our stay. Please share your comments with us. What can we do to improve your care? And these are things you can ask during rounding, and you can also, let them know that these are things, as you reinforce this with them each time when you're rounding and you're asking these questions, and you let them know the importance of the survey they get at the end, some of these words will really resonate with them as to what is will resonate to them as to, when they take that survey and they see those questions, they'll think, oh my gosh, yeah, that nurse leader that rounded on me 2 days, always asked me how my care was. So, and let them know, say to them, we want to hear from you. Please share your experiences with us. When you will receive a survey at the end of your stay, and we really want to hear from you. And while you're rounding, let us know if you have any questions about your treatment plan. Use those scripted key words at key times that will help us to embed that information in them, but also encourage them to fill out their survey. And let us know if your room is not comfortable. Those are just examples so that it gives you a little bit of an idea of what we can say. Now, what we shouldn't say and what does not comply with CMS is to, as you're visiting the patient, you're rounding, say our goal is to always address your needs. You're using that keyword of always and putting that in there. And that's just one of the examples that CMS gives us that they really don't want us to use. Let us know if we're not listening carefully to you. Well, it's the opposite of what we want. In order to provide the best possible care, please tell us how we can always, and go on with that. Or our doctors and nurses always listen carefully to you. That you can see that theme of using that word always, which is ultimately what we all hope to get as we have our surveys returned. But those are the things we can't say when we talk to them about the possibilities of the survey and how important it is for us to get those surveys back from them after their stay. So some additional strategies for introducing the survey is it can start right at admission. We say so many things can start at admission, but we can let them know at admission, on admission, that they'll receive a survey after discharge, how important it is to us, just the very things that we've said. We discussed rounding as anyone does their rounding. However you have it set up in your hospital for leadership, nursing, whomever is doing the rounding, make sure at those points as you talk to them, you talk about their care while they're there, then at the end always end up with, after discharge, you'll receive a survey from us. We really sincerely appreciate it if you fill out the survey. Again, broken record, I know I am, but it's reiterating that and keeping that in the front of their brain at all times to where when they leave, they know they're going to get a survey from us. On discharge, after the discharge paperwork is done and we ask them, if they have any additional questions, we can remind them again that they'll get a survey. Another good time to do this is a lot of us do post-discharge phone calls within 24 to 48 hours, or maybe you do them sooner after discharge, and to let them know that they'll get a survey and how valuable that survey is to us. As we mentioned earlier, we have the posters that you can request from us or make your own and put up. Some people also use tent cards in the patient's rooms, I've heard, that tells them they'll receive a survey following discharge and how would they please fill out that survey and the things it impacts. Bedside shift report is another opportunity. It's just all those things, all those encounters, all those times we have with them that gives us those opportunities. A couple of people have asked about whiteboards before. I think there's so much information already on the whiteboards. I leave that up to you if you have room to put it on the whiteboards in your room, something related to the survey, but usually we've got a lot of other information on there that's more care information at the time while they're in the hospital. But I leave that up to you as to what you're doing with that. So when we talk about, we've went over ways that we can reiterate to the patient because we're dependent on them to get these returns, and we basically need to encourage and encourage and encourage all the way through. But then what do we do with that information, or what do we do? And we talked in the beginning about one of the objectives, talked about establishing benchmarks. And to establish your benchmarks, that has to be a decision of your leadership team, should you do that, as to how you want to measure those benchmarks. And it can be department oriented or service line. And with our discussion today, we're specifically talking about inpatient HCAHPS. So that could be, if you've got more than one inpatient unit, you can split your units and do a service line as your inpatients, or you can do the department as a whole. But look at what your return rate has been for the last 4 quarters and your rolling quarters. What is your return rate? And that's a really important thing to look at. And note, I encourage you to look at least a year, if not 6 quarters even, because of the variability we can see so often in smaller hospitals, and really see some peaks and valleys. Look at it and look at where you want to be thinking about that. Really, as I said, look at that. If your current return rate's at 17%, you probably don't want to set the goal at 30%, even though that's what we're seeing nationally. You're going to want to set something that works with your leadership team. And that's where you really need to have that team discussion around this and say, we're only getting back 17% of the surveys that we're sending out. Where do we want to be with this? And set it, and then decide who you're going to benchmark against, and what your benchmark is going to be. Are you going to benchmark against yourself for an increase in those surveys coming in? Are you going to benchmark yourselves against state and national return rates? And those can vary by state. That's why I didn't put any numbers in here. But look at that and decide in your leadership team, what's a meaningful number to you? What do you hope to get back, that it will be a good reflection of the care that you are delivering? And also, as we look at, we know this is a very important piece for us, and we want to get our numbers up with our star ratings. So if you're looking to use that so that you get enough surveys returned that you can explore using that. And it's very important. So please, look at your own data and establish your benchmarks from that. And with that, then after you set those, will come your opportunities for performance improvement. If you're currently at 17% and your goal for the next 6 months, if you're doing a shorter term goal rather than a long-term goal, is to be at 20% for the next 2 quarters, you really need to engage the staff. And I guess what I really should have put at the top is it's got to be leadership driven. You set your goal, kind of went from the bottom up here. So, and it's got to be leadership driven. Determine the number, work to hold the gains that you make, look at all the opportunities that you've got. Decide, where are we going to put forth, our efforts? Are we rounding? Are we talking about our surveys when we round? Are we talking about to the patients at all that they'll receive a survey from us when they get home from their hospital stay? And let them, and decide what is your performance improvement that you're going to do? What are the steps you're going to take? But engage your staff, because without that top down, the leadership support and engagement of all of your staff, it's not going to move forward that we all want. And those numbers are so important to us. So leadership needs to be behind it. They need to drive this, and we really need to work. The goal is to get your survey return rate there. That is what you want to hopefully improve your scores, and especially your top box scores, and see a true reflection of the service and the care that your institution is delivering, and get those return rates up a little higher. There are some hospitals in our services that are really doing a wonderful job at this, and are getting some really nice return rates, to their surveys. And one of those, I know I sent out quite a few emails, but one of those people I'm very thrilled that I heard back from was Pam Harrison. Pam is the administrative assistant and foundation coordinator at Community Memorial Healthcare in Marysville, Kansas. And they have been very successful in their return rate. And I was hoping, and Pam, I think you'll be able to unmute yourself. If you could talk to us just a little bit about what you're doing at your hospital that you've been able to maintain a good return rate for the past couple years.
Okay, thanks. I think for us, one of the biggest advantages that we've had within the last several years has been switching to mail surveys. We've done surveys here for years. We started out years ago when they started doing HCAHP stuff, and everybody kept telling us, you know, phone surveys is the way to go because there's better return rates. And we just were not seeing that. We also do our own in-house surveys for some of our lines for ambulatory surgery in our emergency room and for our outpatient referral clinic. And on those are mail surveys, and we were really getting good responses from our patients on those. And so, you know, we kind of did what the vendors kept telling us, that the phone was better to go that way. And we did go back to HCAHPS again. For a while, we did our own just in-house hospital inpatient surveys as well. Finally, when we decided to go back with HCAHPS again, tried the phone surveys. And again, just dismal rates, just didn't even seem worth the money we were spending on them for the data that we were getting back. It just wasn't very useful. So one of the things, because we were looking at our demographics, and I guess that's one, you know your demographics, because we are a rural farming community and a large percentage of our patients are Medicare age. And what we found is that several of them had been scammed over the phone recently. And so they were refusing. If someone was calling them, they just, as much as we tried to put out and we tried to educate them, and we would include information about what would come up on their caller ID when the phone came in, and they were still so very hesitant to do that. And if any of you are from a small community, you know that, you know, when that happens to somebody, those end up in the local newspaper. It's talked about at the coffee shop downtown, and it just, people were very leery about taking responses over the phone just because they thought they were going to get caught up in something. About this time, we were starting our 3-year program with Custom Learning Systems, and we were talking with them about our disappointment with the current vendor we were using and the rates that we were getting. And they suggested we reach out to ICAHN and see about the written surveys that they were offering. And since we have done that, our surveys have increased exponentially, just because I think our especially our elderly population are so much more open. They have to sit down and fill out a survey. When they get things in the mail, they tend to look at them and open them and respond to them. So I think that helps us a lot. The other thing that I think helps us is, I think people see our responses to their comments and their things on the in-house surveys that we do. I think they can recognize that their thoughts and their comments and their feedback matters to us, because they can see some of the changes that we've done based on things that have come back in. The same is true with our HCAHPS. One of the things that we had noticed is patients were saying that our rooms, their rooms weren't getting cleaned, and housekeeping knew they were doing it. And what we discovered, housekeeping worked really hard to try and figure out what was going on. And they found out they were trying to be respectful of the patient and slipping in to clean their rooms when they were having out of the room therapy, or they were being taken for x-rays, or they were trying, if possible, to clean so that they wouldn't disturb the patient. What they found then is the patient wasn't seeing them in the rooms and didn't realize that their room was being cleaned. So something just as little as the housekeeper leaving a note. cleaned your room today, so sorry I missed you, and would write their name or something on just some little note from the housekeeper to let them know that they were there. So just it's little things like that, little things that patients, it's important to them, that we take seriously. We're really serious about, if they want to be contacted, calling them back. We have a system, a QDC system, we enter that information too. So there's constant follow-up on, are we, the patients that are asking to be contacted, are we doing that? And tracking our responses to them and how we handle those situations. Our CEO does do, that's not so much with COVID, because just going into the rooms then, but prior to COVID, our CEO would round on patients and he would give them his business card and say, this is my direct line. If you have any problems or any issues that come up while you're here, please reach out to me. And then he would again share, sometimes in his conversations with them about the surveys. Most of the time, reminders of that they would be getting a survey is coming from our discharge planner when she is talking with the patients on discharge information. And I don't know this for sure. I know when we were doing phone surveys and when we started doing mail surveys, they were putting something in the discharge packet, just a little flyer in there that was saying, you may receive a survey in the mail or at the phone at the time we were doing phone surveys, just to let them know that this is what you can expect. This is who it's going to be from. And it's very important that for us to get that information and that feedback to us so that we can make improvements and continue to do what we can to make the care and your stay here better. So I think that has helped as well. We also have a really good quality program and we track a lot of measures. And so those things going in to CMS, along with our patient satisfaction and getting more surveys in, we're finally, over the last few years, have been able to reach that 100 minimum threshold, I believe it is, to get star ratings. And so, we had achieved that 5-star CMS rating. So, and our local newspaper was very good about picking up that story and a lot of other things. Some of those, our hospitals received some, national accolades and based on quality measures and patient satisfaction and being fiscally responsible and those types of things.
I tried to send it myself, did it not go? Dang it.
And I think, our CEO is always asked to do presentations and he's very willing to go out and do those, as is some of our staff. And so they share those things, and kind of in those talks, they're also telling people how important it is for that feedback to come back to us, because not only does it help us internally to improve ourselves, but it also helps the hospital overall, with some of these accolades that we're receiving.
That's amazing. That's wonderful. Oh gosh, Pam, thank you for sharing and congratulations on your 5-star rating. That's wonderful.
Yeah, we're not anymore. We're hoping to get back when the new scores come out this month.
Sure. Wow. Thank you.
You're welcome.
Is there anyone else on the line that would like to share what they're doing, or do you have any questions for Pam or myself? Well, I want to thank you for taking time to join us today, and just in recapping a little of our objectives we talked about establishing our benchmarks. First, know where you are on that return rate. And if you're not where you want to be, and hopefully everyone is challenging themselves to even get a higher return rate, look at those, set some benchmarks, hold your feet to it and trudge forward, and really engage your staff, let them know how that improvement in return rate will impact your results. And you just heard the wonderful story from Pam about their community and the community embracing them. And these are important stories to tell. And that was something I hadn't mentioned that she did, that's just critical is a lot of times in our hospitals, we get those opportunities to talk. We're members, or if we're not members, we get invitations to bring topics and discuss those with all of our community organizations and schools and people in our community, and go to our local press, our newspaper, the local radio station, and let them know what's happening at the hospital, and do those talk shows and let them know. She gave us great examples of how sharing your story and why those surveys are so important to get back does impact the care we deliver and only helps us to improve. And that helps us with our performance improvement. And so I think that we've talked about a lot of strategies today to help improve your scores. So I hope you can take something from this that will help you a little. I've included some references and resources that I use today that I think are very important. I think the guidelines from CMS on HCAHPS, whenever you have questions, is very important. The fact sheet, if you don't go online and look at that, that is published and is always a great source of information. There's information just in general on hospital systems and stuff for HCAHPS and some things they've did. And the last reference on the page is, as we just talked about, star ratings and how your work that you do and your surveys can help you with your star ratings, which is so important to us. So there's some references and resources. And again, I thank you all for taking your time to join us today. And I will be sending the slide deck to N to read so that he can get it posted for all of you that signed up for the webinar. And I thank you so much for joining us today, and happy patient surveying going forward. And I look forward to hopefully talking with you again soon. Have a wonderful afternoon. Bye-bye.